Hi, my name is Joey Borganos. For today's video, I'll be doing the return demonstration for oxygen therapy via nasal cannula and nasopharyngeal suctioning. The oxygen therapy is a means to provide oxygen according to target saturation rates as per doctor's order to achieve normal oxygen saturation level for acute and chronically ill patients. We should remember that if we are administering oxygen, we must monitor the patient to keep the saturation level within the required target range because oxygen should be reduced or discontinued in a stable patient with satisfactory oxygen saturation level. So we should remember that if we are administering oxygen, we must monitor the patient to keep the saturation levels within the required target range because oxygen should be reduced or discontinued in stable patients with satisfactory oxygen saturation levels. Before starting the procedure, I first need to assess the patient's skin and mucous membrane, as I need to note the color of the skin if cyanosis is present. Then I'll check the breathing patterns, chest movement, lung sounds, or any presence of clinical signs of respiratory distress. Then I will check the vital signs, including the oxygen saturation level. So if the patient has COPD, and check all the medical laboratory tests if available. Next is to get all the equipment needed. In this case, I need a pulse oximeter, oxygen flow meter, portable oxygen supply, nasal cannula, water-soluble lubricant, and gauze if necessary. And then, I will perform hand hygiene and wear PPE if indicated. Upon entering the patient's rooms, I will greet the patient, introduce myself, and verify the patient's two identifiers, which are the name and birthday. Next, I will ensure the patient's privacy by closing the door or draping the curtains. Then I will explain the procedure and how the client can cooperate. Lastly, I will educate the patient about safety precautions such as smoking is prohibited when oxygen is in use. So now, to set up the oxygen and humidifier, we have to look for the end connector and connect it to the oxygen source. So let's assume that I have an oxygen tank here. So turn on the oxygen at the prescribed rate, ensuring proper functioning, and then adjust the flow rate as ordered and check if flowing out of prongs. So in this case, I'll be using a nasal cannula. So I'll put the cannula over the client's face. So like this. And then I'll make sure that the prongs are facing upward when inserted into the nose. And if the cannula will not stay in place, I'll secure it with tape at the side of the face. So I'll put tape on the side of the face. Then I will assess the patient regularly. I will check if there's any irritation or discomfort, and remember that tubing should be secured but not tight against the skin. So if the client has an irritation in his nares, I will apply the water-soluble lubricant to soothe the mucous membrane. And if there's any irritation to the client's ear from the cannula strap, I will put a gauze pad to relieve the discomfort. And then I will encourage the patient to breathe through his nose to receive the oxygen coming from the tank and not through his mouth. And then I will inspect the equipment regularly. I will check the flow and the level of water in the humidifier. I will ensure that the water is not collecting in the tubing loops and that safety precautions are followed. And then I will perform hand hygiene. Then I will document all the findings in the patient record. Now I will demonstrate the nasopharyngeal suctioning. This method is used to clear secretions from the nasopharynx by applying negative pressure via a suction catheter. So now I'm going to show you how to assemble the suctioning catheter. So for this procedure, I will need a suctioning catheter, stir gloves, and saline water that must be in a sterile container to prime the suctioning catheter before I administer it to the patient. So next I'll be doing is to do all the preliminaries as I previously mentioned. And then I will perform hand hygiene. And then I will assist the patient in a comfortable position. So in this procedure, the patient must be in a semi or high polar's position. And then I will put the clean gloves. Next is I will open the packaging and touch only the catheter using my non-dominant hand. So I will use my dominant hand to open the packaging. And then this one. Then I will prime the catheter using this saline water in a sterile container. So let's assume that there's a saline water here. Then I will prime it. So now I'll be administering the nasopharyngeal suctioning. I will insert at least 4 inches of the catheter in a linear motion. So the next thing I will do is to insert the end of the catheter into a suctioning machine. So let's assume that I have a suctioning machine here. And after that, I will now perform the suctioning. So remember that when performing suctioning, you have to rotate the catheter gently. And remember that a function attempt should last at least 10 to 15 seconds. And after suctioning the nose of the patient, we have to immediately dispose the suction catheter and replace the tip connector onto the suction tubing. Then turn off the suction unit. Next is to assess the effectiveness of the functioning, and then I will auscultate the patient's breath sounds. So I will start to auscultate now. And then I will observe the skin color and the oxygen saturation of the patient. And then I will document all the findings. So that is all for the nasopharyngeal suctioning. Then I will perform hand hygiene.